All right, it's 5 o'clock, that time we come together every day to not only get an update on where we are in our fight against the coronavirus, but to make sure that we are committed to doing what it takes to protect one another, that we are ready and resilient and strong to make sure that we pass this test of humanity. So let's start the way we always start, by knowing and saying that we will get through this. We will get through this together. Say it with me. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. I'm helped today by Rachel. Thank you, Rachel. By James and by Kenneth, who is at home, helping to run the broadcast, being healthy at home. We know we're going to get through this because of the 10 steps that we talk about every single day that are just a good reminder of the things that we need to be doing to make sure that we are protecting other people around us. Remember, everybody counts. Everybody matters in this battle against the coronavirus. What any individual does can ultimately have a good or a bad impact on other people. The number one rule is to stay healthy at home. Now, we are making our plans. We are talking about reopening parts of our economy, but right now, as we get ready for that, we need you to be healthy at home. We talked a lot about the greatest generation and other generations that have had to rise to face challenges. I know it feels like it's been a long time. It's a little over a month, but remember, that greatest generation went through years of what it took to protect this world and to defeat the adversary that they faced. So let's make sure that we're strong enough, even with a little cabin fever, even getting a little antsy, that we do what it takes to protect one another around us. So healthy at home is number one. Number two is avoid crowds and gatherings of any type. There should not be any mass gatherings for any reason. Remember, that's how the coronavirus spreads, and we're now seeing stories from all over the United States about whether it's a sporting event or another mass gathering, how this coronavirus has spread. Practicing social distancing, knowing when to seek care. You all have done a great job on this, and it's the reason that we feel a lot better about our healthcare capacity. It's not that the virus is different than we thought it was. It's that you all have done an amazing job at staying healthy at home, social distancing, and knowing when to seek care. And that has protected a lot of people. Let me just be as clear as I can. There would be a lot more people who would not be with us today, whose ages and counties I would have read by now, that are still with us because of you. I am so proud of you, but we got to keep it up. All right, kycovid19.ky.gov. It is updated all the time, and we look at your comments. We hadn't updated the actions that we've taken in the last 3 or so days. Now updated. Wash your hands and surfaces. Don't stop. Incredibly important. Apply for benefits. We'll get an update on unemployment tomorrow. I know some have been waiting for a long time. This is a historic number of claims by a significant factor. We are working as fast as we can. No one will be penalized. We'll make sure that you get what you need to get through this. Also, sign up for Medicaid. That's going to help all of those frontline healthcare workers that are working for you. Prioritize your mental health. And I'll say that I've struggled with this. I have. We all have who are working on this. And I know you have. I've had trouble, calling people that I know that I would normally talk to. It's difficult. It's isolating. It's hard. And it's hard every day when you wait to get numbers in of new cases or people who have passed away. But one of my pastors, his spouse, had a birthday last night, and they did it by a Zoom call. And I'll tell you, I feel better today because I participated in it. So just do what you need to do. Make sure that just because you're social distancing, you're not self-isolating. I think I now know a little bit of how that feels. Do not travel, any reason, no matter what, don't travel at all, and report noncompliance. We always talk about our 10 steps plus one. Please, please, please fill out your census. You have time. It is incredibly important. Everybody who fills out the census, it may be worth a couple $1,000s in federal funding that we're going to get. And so make sure that you do that because we're going to need these dollars. It doesn't take long. It's really easy. Please do it. All right. We've also talked about filling up social media with those positive things that you're doing. And I was thinking a little bit and wanted to share with my thoughts about how many heroes and sheroes we have out there on a daily basis. Remember, in this crisis, what everybody does matters. And everybody who makes a good decision does something heroic. And how many of these challenges that face, not every generation, but it's facing ours, how many of them have the opportunity for what everybody does or decides to be heroic? So I thought a little bit about the different types of heroes we have, and I know I'm going to leave some out. We have our healthcare heroes. We talk about them a lot, but we should be. That is everybody involved in that system that's helped taking care of our COVID-19 patients that know every day that they could be exposed to the virus, but are doing it because that is their calling. And I got to tell you, we have better results because we have better care and better caregivers than anybody could imagine. These are also our folks working in nursing homes and doing senior living facilities and doing so much. We have our frontline heroes, and this has changed the way that we think about that in this type of pandemic. We have our police, our firefighters, our EMS, our corrections officers. We normally think about them. We have our truck drivers, our utility workers, our grocery store employees, our janitorial and cleaning staff and custodians. I mean, we have more types of frontline heroes during this than I think we had ever thought of and appreciated. And then we have our everyday heroes, which is most of you and me together. We have our kids that are sacrificing by not going to school, knowing that they could spread the virus. They're heroes for that sacrifice. We have our small business owners whose doors are closed right now, who again are passing that test of humanity, putting lives ahead of anything else. They are heroes. We have all of those that have had to apply for benefits, that have that uncertainty. They are heroes for their sacrifice. And then we have everybody who every day does the right thing. Think about it. Just by following the guidance, by doing the right thing, by limiting our contacts, just by staying home, right? Just by staying home. Your actions may have and likely did save lives. Well, isn't that the definition of being a hero? So right now we have a state full of millions of heroes and sheroes, millions that are out there, and I say it a lot, but I'm really proud to be your governor. So let's look at a little bit of our heroes in action. Okay, so we talked about our healthcare heroes. Here's an example. I mean, look, when you have to go into your work wearing everything that she is, you know how this virus can spread, how aggressive it is, and you also know how deadly it can be. All right, I believe that this is from Green River Memorial Baptist. Again, congregations sacrificing to do the right thing. But I love this. They kind of laid out the photos of what the congregation looked like. I want to thank them for doing the right thing to protect their congregation like so many others are. All right, these are our heroes who are missing special moments with people they care about. This is a grandson visiting his 97-year-old grandfather, and the grandfather wanted to invite him in, but knowing that decision that grandson is making right now not to engage in social distancing is protecting his grandfather. Yeah, this is one of our first NTI graduates from Jefferson County High School. Pretty special. Again, having to do things a little bit different, but understanding that that's how we protect one another. All right, this is the Breckinridge County Fighting Tigers senior baseball players, and I enjoy this because this is a little bit of levity. First, they're saying stay home because that's where you're safe, but I also love the stay home so our moms can start yelling about bad calls again. I'm a baseball dad. I've been there. I admit I worried about losing votes at every baseball game I was at, and it still overwhelmed me every single time. I'm going to hopefully come out of this as a better person with this, but I can't promise to umpires that that'll be the case. This is Keeneland. And Keeneland is not running right now. It's something that a lot of people enjoy during their race times, lighting up green, just like all the rest of us, to remember those we've lost. And this is the Todd County Elkton Square lit up green. This is in every county. Think about it, every county. We show one of these every day. Do you ever remember every courthouse, every downtown, every area of Kentucky being so united, not just both in fighting this virus, but in caring about each other and making sure that we recognize those that we've lost. We're in the midst of something difficult, but our response is something really, really special. Yeah. This is Hopkins County. It's been hit pretty hard. Again, a whole lot of heroes out there, and we appreciate every single one of you. Being a hero isn't supposed to be easy, and so we got to keep it up. But let's make sure that we get the job done and that we protect one another. So yesterday, I forgot the new step that we're taking each time, and that is to make sure that we're including everybody and we learn how to include everybody. We want to come out of passing the test of humanity as better people. And yesterday I messed up in that we did not take the time to learn a little new sign language. So I do remember what we were supposed to learn yesterday, and that is the sign for love. So Rachel, it's love. Love. All right, so for everybody out there practicing, one more time, it's love. And we love the steps you're taking, your commitment. I love being your governor, and we're going to get through this. We absolutely are. Wanted to take a minute. It is Sunday, and recognize all of those houses of worship that are stepping up, protecting their people, and doing the right thing. They span all across the state. And today we have a message from a Mayfield pastor in Western Kentucky.
Hi, I'm Joey Reed, pastor of Mayfield First United Methodist Church in Mayfield, Kentucky. Since the COVID-19 quarantine, our worship team has been broadcasting live from our historic downtown sanctuary location. We've been broadcasting to people who are safe at home and keeping other people safe by staying at home. There are some folks who are interested in asserting their rights through this, and I understand that. I believe in those same rights. But I also believe in a Savior who calls upon us to sacrifice ourselves for others, to lay down our lives when need be. So I'm encouraging you to stay home. This is the Easter season. This is the time when our watching and waiting turns from hope into joy and joy turns into power, but not as the world sees power. This is the power of the Holy Spirit to give ourselves away in love. So I'm encouraging you to shelter in place, stay at home, wait for the experts, because whether you're at home or in the sanctuary, God will meet you where you are. And that's the moment that we realize God goes with us through this. That's how we're going to get through this. We're going to get through this together. Hi, I'm Joey Reed.
All right, a few updates, and then we'll go right into today's report. First, our new testing sites, again, start on Tuesday. It is drive-through testing. Starts at 8:30 a.m. in Paducah, Madisonville, Somerset, and Pikeville. We need people in those areas, in the general geographic areas, to sign up. The sites want to do more than 300 tests per day. I want to make sure we do every single one of those tests each day. Now, we have more than 300 in each of the regions that fall into those that are eligible, but we need you to go ahead. It's Sunday, right? We're starting this Tuesday morning, and start signing up. The more that we can test, the more our capacity increases, the better. And it's critically important that we make sure that we get folks, especially that are sick or who have been exposed or think that they have been exposed through these testing sites. This coming Wednesday, we'll have an announcement about our next testing sites. Again, we talked 2 days ago and then referenced them yesterday about our benchmarks as we look towards the future and talking about different metrics we're going to be looking at about when we can start easing some of these restrictions. And again, just wanted to talk through them real quick. Number one is the number and the rate of new cases. The White House guidance that we are taking very seriously says we need to see a decrease for 2 weeks or a decrease in the rate. Obviously, that is something that Dr. Stack will watch and will make the call on. Number two is increased testing capacity and contact tracing. We're going to talk about some of the teams that we're going to put together to work on this internally here. I think we'll be able to make that announcement probably Tuesday. One will be contact tracing, and that's how we got to build up that group for all of Kentucky. And another one will likely be on the testing capacity itself. Remember, the testing capacity isn't that we got machines or a lab that can do X number of tests. It's the materials that we need to do the test, the swabs, the reagent, that's the liquid you got to put it in to preserve it, the cartridges, which are what a different rapid test requires to run through. We have more capacity right now than we have actual materials. So our limitation and what we'll be pushing for are the actual testing supplies, not the capacity, and we hope that eventually we will have enough to reach our capacity. Number three is PPE, personal protective equipment. That will be both for our healthcare professionals and for industry as they're going to open up. Remember, our new normal will be different than the old normal, and that you will see a lot of masks and a lot of gloves and a lot of other steps virtually everywhere until we find that vaccine. The world's going to look different until we get there. But our new normal will be one that we can adjust to until we can get back to something resembling a little more of the old normal. Ability to protect at-risk populations. Secretary Freelander talked about our steps here, and I didn't know that the day before had lost somebody very close to him. We're going to talk about another one of those individuals and they lost more people in that. You're going to start hearing, I think the national news is talking about that today and tomorrow. Our goal is going to be that we know that we have the PPE on hand, that we still have the capacity to make sure that we can deal with that spike. And then the status of a vaccine and treatment. As we get closer to that, obviously that changes the whole ball game, right? We know this will be gradual and phased, but the timing of a vaccine or proven significant treatment can change everything, and that'll be a time where maybe we can get closer back to the old normal. But in all of it, gradual, phased, and we got to be fluid and flexible. Because if all of a sudden we have a big spike, well, we gotta again do what it takes to protect the people around us. So I know we talked about that the last couple of days, but I know this is going to be top of mind for you. You want to know where we are, and you want to know when things could change. And this is what we're going to be looking at, and we're going to try to provide, as we get a little more into it, where we think we are on each of these, to the extent we can. Obviously, the vaccine is out of our control, but we do want to follow the news and see where we are going on that. All right, today's numbers have some good and some bad, or some bad and some good as it goes. So today we are reporting our highest number of new cases that we ever have. 273 new cases of COVID-19. Those cases break down as 129 in Jefferson, 21 in Kenton, 17 in Davis, 17 in Muhlenberg, 10 in Butler, 9 in Graves, 8 in Jackson and Warren, 6 in Adair and Boone, 5 in Henderson and Ohio, 4 in Fayette, 3 in Russell, 2 in Bullitt and Hopkins, and 1 in Bourbon, Campbell, Clay, Cumberland, Fulton, Grayson, Knox, Lewis, McCreary, McLean, Spencer, and Woodford, and we're working on 9 others. Once we remove duplicates and cases that do not meet the definition for confirmed cases, our total number of cases in Kentucky is 2,960. So we're getting very close to 3,000 cases here in the Commonwealth. We always knew we'd have at least that number. In fact, right now, we believed we'd have significantly more, even with the testing capacity we have. You are flattening the curve. But let's remember there is a curve, right? There is an escalation. There's going to be a day where we have the largest number of cases. That's the way that that this works. But also know that we're not in the 14 days that we talk about of decreasing that we need to, under the White House guidelines, to do certain things. I mean, we are still in the midst of this fight against a deadly and highly contagious virus. So let's make sure, as much as we're looking at those benchmarks and we're looking at the future, that we are acting in the present and we are doing the things that it takes to protect one another. Total numbers of Kentuckians tested, and this is the weekend, so even with these numbers, we don't have all labs reporting. Total tested 32,319. Our hope is next week we'll jump with 4 sites very significantly there. Number ever hospitalized in Kentucky, 1,011. Currently hospitalized, 265. Ever in the ICU, 532. Currently in the ICU, 149. Let's think about those folks. That means that they are struggling or at least need more care. And my favorite number, those recovered, 1,122. Now the percentage recovered versus the total number of cases is down a little bit today from yesterday because we have so many new cases. And remember, it takes a while to get over this virus. But I think we've got, James, a new video of one of our folks that has recovered, and it's something to celebrate each and every time. We'll see if we have that video. Where are you when we need you, Kenneth? It's worth it every time. If that's our video, that's our video. That individual is coming out of the hospital. We want to show these, especially for those that were in harm's way, as much as we can, right? We all need hope. We all need inspiration as we get through this. And those who are better, we are so excited. But we do have those that don't recover. We do. That's why you are making the sacrifices that you're making. That's why we've changed our lives and our economy. That's why right now you may be feeling that anxiety or a little stir crazy, is because how much we have done to try to make sure that that's the outcome and that we don't lose more people. So today we have 4 new deaths to the coronavirus. And while that's significantly less than we've had in some other days, again, 4 individuals, 4 families that are oh so important. So let's remember, let's light up our houses green. I'll be lighting mine up, and we'll light this Capitol up green as well. And let's remember these families. Let's ring our bells tomorrow at 10 a.m. so that people out there know that they are not alone. And even if they've suffered loss during this, that while we can't be with them presently, that we are certainly with them in so many other ways. Our total number of deaths is now at 148. When we look at those 4 cases, and I'm going to read something in a minute that I know I read off ages and genders and counties, and I know it almost sounds like it's not a real person. It is. But this is the best way that I can honor them while respecting their privacy until a family gives us permission to talk about it. So while these sound like numbers, remember they're people. An 85-year-old female from Jackson County, a 61-year-old male from Jefferson County, a 94-year-old female from Hopkins County, and a 93-year-old female from Graves County. As we look at the breakdown of race, of total number of cases known, we know 76.35% of the racial data for total cases. Of that, 77.71% of positive cases are white, 13.13% are black or African American, 3.75% are Asian, and 5.36% are multiracial. In ethnicity, we know 71% of the ethnicity of total positive cases, and they break down as 92.61% non-Hispanic and 7.39% Hispanic. Of deaths, we know the racial data of 81% of the deaths, and of those, 77.5% white, 21.67% black or African American, 0.83% Asian. Again, a definite disparity that we know and we've got to recognize. And while it's been caused by hundreds of years of inequality, something that I hope that we are committed to truly doing something about, not just in the midst of this pandemic, but moving forward so that we don't see disparity in the loss of human life in the next pandemic or for any other reason. Today I've gotten permission to put a face and a person on one of these losses. So today we're remembering Frida Woods. Frida Ferguson Woods, her family wanted us to remember her, to know that she is not just a number, a county, an age, and a gender. And this was her granddaughter. She said she is not just an 85-year-old woman from Hopkins County on a daily list. No, she's not. She said, my Nana was a wife, a mother, and a grandmother. She was a talker and also a storyteller. This July, she and her husband, Doug, would have celebrated 64 years of marriage. They met when she was a car hop, and he returned there every day to eat. She was one of the most headstrong people I've ever known, her granddaughter wrote. My grandfather served as a drill sergeant in the United States Air Force, but he was no match for my Nana. Now, even more heartbreaking for this one family, they've learned that their grandfather have also tested positive. Our hearts go out to the Woods family. We're thinking about you, and when we light our houses green tonight, we'll be thinking about your beloved Nana and your grandfather as well. Frida and her family are one of the reasons we all have to do our part, so we have fewer families mourning, fewer communities that are in harm. As Frida's family unfortunately knows too well, this threat is very real. And I know that if they were here, they would say, please follow the guidelines, practice social distancing, make sure that there aren't more families than there have to be who go through this loss. I want to thank her family for giving us permission to put an amazing special face on something that each day we might read more as a number. All right, we're just going to talk about one of the areas that we typically update each day. Those are long-term care facilities, and that's because this is where the major change was from yesterday. We have 33 more residents, 8 more staff, and 4 more deaths in our long-term care facilities. Those that work with them are working incredibly hard, but that's what this virus is. It comes for our most vulnerable. And this is why one of our specific guidelines that we have is to make sure that in any reopening plans and steps we take, that we're protecting these folks. I want to ask Dr. Stack to come up here and just give a little bit of his thoughts on today's number, obviously where we may be in the curve, and some of the steps just generally that we're taking and where we are.
Thank you, Governor, and good evening. On this slide here, real quick, if I could highlight a few things. So there are 46 facilities, nursing home facilities, where we have positive coronavirus patients. This is probably one of the most vulnerable populations because of their age and the fact that it's a confined population. And when it's in 46 different facilities, we know there's the risk that it could increase and that there could be more numbers, significantly more numbers in the days and the weeks ahead. So when we talk about the criteria for when we reopen the state in a phased approach, I look at a number of different metrics. We report these, but I have to look at this with a whole team of folks back at the Department of Public Health and in the local health departments to try to make sense out of what does the future maybe hold. So, James, if you could show the 7 benchmark slide. So keeping this in mind, the benchmarks that we selected for the state are directly in line with what the federal government has proposed for their plan to reopen America. And the number and rate of new cases, I'm going to bucket these for you so you try to think of it a little bit differently. The number and rate of new cases is a measurement. It's something we report to you every day. It's on the website, and you can track that over time. You can look at publicly available sites where they even graph it out for you. And so right now, because we have the highest number in a single day, we're clearly not in a 14-day decline yet. I would say our numbers are still relatively flat. They're relatively plateaued, even though today's the biggest number, but that's clearly not a 14-day decline. And that's the first metric we have to hit before we can start to say we're on the backside of the first peak, so we can maybe begin to try to safely think about opening things up. The next 2 items, increased access to testing and the contact tracing, is something we're already doing, but we're going to have to do in a much more robust way for a longer term of time than we have previously done for most diseases. But the increased testing capacity, to put that in context, some of the estimates I've seen and some of the ones that I've come up with for us in Kentucky would be we may have to, on a typical day, test 1/10 to 1/3 of 1% of the total population. So that would be about 9,000 to 13,500 tests a day. And there have been other estimates from others that sort of were in the middle of that range for other areas in the country. I don't think any of us really know what the right answer is, but using that as a starting point, as an educated inference, that would mean we would, in 4 days, exceed the total number of tests we think have already been done in Kentucky over the last about 6 weeks. So if we did 9,000 tests a day over 4 days, that would be 36,000 tests. And we've done about 33,000 tests so far in Kentucky. since we had our first patient on March 6th. So just to put this in context, where we have to get is substantially more than what we've already done in 6 weeks, and that's just over a 4-day period. And then for the personal protective equipment, we've made sure as much as we can that we're getting resources to help support the hospitals. But the hospitals are just one piece of this. We also have nursing homes that we're trying to help support. And then there are all the doctor's offices and clinics that people use that are still have to be addressed if they're going to open up. So we have a huge need for personal protective equipment that goes well beyond even what we've tried to do in a crisis management. So those next two things are about making sure the supply chain support the resources needed to keep both patients and healthcare workers safe. Then protecting at-risk populations and social distancing, those are things you all do. We're going to help you. We're going to give guidelines, requirements at times, and we're going to work, the governor is, with each industry to try to have the industries propose things that will help to comply with these. But those are things that you, the public, in partnership with us trying to help give guidance, are going to have to work through for our new normal, what that looks like. The preparedness for future spikes means we know this isn't going to be a surprise next time. So it was a surprise when the disease first showed up in December in China, but it's not a surprise now. We know the disease is here, and we know until we get vaccines and treatments, it's going to come back when we stop doing all of these social distancing measures. So you are forever going to have to wash your hands a lot more than you ever did before. Wearing masks is probably going to become a much more normal and typical part of our lives going forward. And doing other steps to have social distancing are going to be part of our new normal. And so while we work on those, so the protecting populations and social distancing with you, we're going to have to keep prepared so that if we see another resurgence that we'll find by tracking number of new cases and doing contact tracing, then we're going to have to take steps to kind of dial back up or down the measures we do. But obviously we're going to work real hard to try to do this in as calibrated a way as we can to minimize disruptions. Now I'm going to tell you, if you go to any of these publicly available websites, you can see Japan, unfortunately for Japan, is having a resurgence right now. They're having the second bump that we show on the St. Louis curve. That is something we have to work very, very hard to avoid. We want to have little ripples. We want to have a flat line. We don't want any disease. But since we're not going to be able to achieve that, we want to have little ripples over time. We don't want any big spikes. And should somehow we get a spike of some sort, that's why we have to make sure we're prepared for it so we can keep everyone as safe as possible. So I know we all target a May 1 date that sort of got put out there. We're going to work real hard with all the healthcare community and others to try to make sure we can start to do phase steps as soon as are reasonably safe. But remember, we're going to have to keep looking for that rate of new cases to determine when we get to that first stage gate, that first benchmark, when it is reasonable to start taking some of those steps. So we have a lot of work ahead of us, but like the governor says every day, I do believe we're going to get through this, and we'll get through it together, but we're going to get through it because of all these wonderful stories of Team Kentucky coming together. And as I finish out here real quick, with the nursing homes and all the hard work that's gone into that, I'd like to we can never thank everybody, so thank you to everybody, but Lord's Mercy Hospital in Paducah, Western Baptist, and then General Baptist Health System, who's helped us in a number of regions to help relocate patients from nursing homes into hospitals. Norton in Louisville has also been very helpful. There have been others as well, but thank you to them. And then for my team, it occurred to me, or at least it was brought to my attention, we have so many different aspects. We have a whole team that does preparedness. So when we're procuring PPE, when we're distributing PPE, when we're working with regional plans to try to help work with partners across the state, we have a whole team that does that. So Becky Gillis is the head of that team, and she leads our unit of the disaster response team over at the Emergency Operations Center for Kentucky Emergency Management. And she has an entire team that supports her in doing that. So to Becky and the preparedness team, thank you very much for what you've done. You are the same sort of heroes that we've had in the laboratory community and the epidemiologists and the many other facets of this response. So thank you.
Thank you. All right. We'll now move into questions. I think we've got Eleanor, Joe, and Monica here with us today, and we'll go back and forth. with some written ones that we have. Now, I believe today is Joe's birthday. Happy birthday. So why don't you go first?
I'd like you to react to the reports today that there have been threats of violence against you online. Has Kentucky State Police increased security for you, and are you concerned about your own safety right now?
The question is if I can react to threats online of violence against me, and is the Kentucky State Police doing any more, and am I worried? The Kentucky State Police is an incredible organization filled with great people. They provide security for me on a daily basis. I fully trust them. They know what they're doing, and I couldn't be in better hands. Several organizers of summer programs for kids are asking if there is a criteria of which activities may be able to continue once we reach the other benchmarks and begin to reopen. That's from Karen Sarr at WUKY. Remember, even with the phase 1 opening, the White House is recommending no school and no group kid activities. It's because our kids come in contact with so many people and when they're together. So, we're going to be watching this even week by week. But activities for summer programs for kids are something that we're going to have to be really careful with. Under the guidance that we've received, that wouldn't really start until even phase 2. And phase 2 is going to be a gradual thing that we're going to have to work towards. Eleanor.
PPE available. Do we think eventually it might be mandated, and will that be provided for people that they have to wear in any sort of situation?
So the question is, with PPE, do we see a stage where people are mandated to wear certain things? Well, let's say right now in the general public, if we're able to ease up on certain things, then we're going to go from encouraging people to wearing cloth masks to highly encouraging people to wear cloth masks. That can't necessarily stop you from getting it, but it does potentially reduce the spread from other people. So without a vaccine or a proven significant treatment, as we are able to reopen things, then yes, it's going to require something that's going to look a lot different. It's going to require in people's work masks and gloves in many locations. It's going to require work being different and people being spread out. And those are plans that we're going to look at and have certain requirements as we're able to take those steps. And so on the PPE, it's not just the hospital folks. It's also going to be really throughout our society until we see a new vaccine. It's not just going to be things that we can't get to before a vaccine or gradual phasing where groups are much smaller. It's going to look very different as we go forward. Recently available blood tests for the coronavirus antibodies are being criticized by some as inaccurate or unreliable. What are my thoughts about the accuracy of these tests, and how big of a part will they play in my decisions to reopen the economy? That is a Dr. Stack question.
All right, I'm going to take just a minute to broaden that out. So there are two major different kinds of tests that we're talking about. One is when we look for the virus in your body. That's a polymerase chain reaction, a PCR test. The most common way we get that sample is to put a Q-tip in the back of your nose or in your lower nose. Maybe one day you'll be able to spit into a little tube, and we'll do it that way with your saliva. So that we look for the virus in your body. That's the one test we've had up until now. There are ways that require a larger machine to do it. Yep, and the governor's got the collection kit here. So there are ways that we use, thank you. So that's when you go in and someone takes a little vial. You'll see them have that little Q-tip here in the end. I'm not putting this in my nose. Anyone who's had it done doesn't want to have it done. But you put this thing all the way in the back of your nose and you spin it, and usually you do both nostrils at the same, one after the other, okay? So a good sample probably is not an experience you want to repeat, but that's a good sample. But we can do it other ways too, and they're probably pretty close to as good, but maybe not quite as good. So we're going to work on that. If we find that doing a saliva test is as good or better, then obviously we're going to try to do ways that are not inconvenient for patients. So polymerase chain reaction test is really, really good for finding the virus. There's a challenge with the PCR test, though. Some people appear to have lingering virus in their nose or in their body, and it's not clear if they're still infectious or not. In fact, the test is so sensitive, just a little bit of virus in there can still show up in the test, but maybe your body's immune system has recovered from it. So this is why the guidelines, you'll see some variation about using repeated testing for clearing people or using clinical recovery from illness. So that, stay tuned, we're going to work through that. And then the antibody tests. This is when we look in your body, it's a blood test, and we check and see if your body has developed proteins to fight off the infection. There's different kinds of proteins, ones that show you are currently or recently infected, and ones that show you have been infected but have appear to have produced an immune response that will protect you going forward. I don't want to disparage these tests. These tests are going to be critical going forward. But remember, this disease is about 4 months old. The tests are very new, and we have to get the ones that work the best, and we have to find out what they mean in the context of this disease and how people respond to the illness. So those rapid tests for antibodies will be very useful going forward, but I would be very careful. And again, I keep telling you over and over, don't go pay cash for tests. If you see a real doctor or a real hospital and they recommend testing, that's your best likelihood that someone actually knows that they're using a good test that's appropriate for the purpose, and it should be done in a setting where they can use insurance or where the state of Kentucky is providing the test for you. Don't hand over cash for those tests.
Monica.
Do you have a deadline or an update on voting for the primary, and when you think you can release more information about that?
Do I have an update on voting for the primary? Not at this time, but I can tell you my position certainly hasn't changed. At this time, it would not be safe for our poll workers or those going in to vote to do it in a traditional way. I want to make sure that we can have a primary election, because a lot will happen as we work up to the general election. So I'm only thinking about the primary election that is safe, but also gives all Kentuckians who are qualified to vote a real opportunity to vote without significant burden. I know that we're working with the Board of Elections and the Secretary of State's office to try to find the best path forward on that. But even if we would start seeing a significant decrease in cases, even if we were able to start opening things up, this election would have to look different. Because when you look at phase 1 under the White House plan, it's groups no larger than 10. And voting is significantly larger than that. Even if you got to phase 2, which if we got there by June, that would be wonderful. Groups no larger than 50, it's really hard to control in those polling locations. And all of them still require those that are in the most vulnerable population to shelter in place. Well, a large part of our poll workers. Every poll worker where I used to vote, now I vote in my garage, but every poll worker where I used to vote falls into that vulnerable population, and we're going to have to protect them. Let's see. It looks like there's questions on the church that filed suit. I believe that their preliminary injunction was denied last night. The ruling fell along the lines that we've been saying. We want everybody to be able to worship. We just want you to do it safely. And nobody wants their worship service to spread the coronavirus, and we have seen examples of that all over the country, and we have seen not just cases come out of it, but even deaths come out of that and any other mass gathering. And that's why the orders that we put out, none of them are particular to any faith-based mass gathering. It's to all mass gatherings. You don't see sporting events right now either that have spread this virus. To my knowledge, every other church in Kentucky is holding either virtual or drive-in services. And we're one of a handful of states that allows drive-in services because we want to make sure that everybody can have that opportunity to worship. And the ruling seemed to say that because we were offering these other options, that we were not unduly restricting people's right to worship. And I just mentioned that at this church, there is a drive-up option, and there is a virtual option. And I just wish everyone would select that, because that would mean everybody is being safe in what they're doing. You can get the same message. I know the experience may seem different. It is different. But this is the way that we can make sure that we use the wisdom that God has granted us, that we continue to be able to worship together, and no one is harmed in the process. Joe.
April 2nd, 17 days ago, you said that you would release 743 low-level state inmates, nonviolent, non-sexual crimes. As of today, have any been released? And if so, how many of those inmates have been released?
The question is, how many of the 700 or so C and individuals that had been convicted of a C and D felony, nonviolent, non-sexual, that were within 6 months of the end of their term, how many of them have been released? I know I've signed the order. It's specific to the individuals. I'm going to have to get you that number. I know it was in process, and the process required certain things before people were released, including them passing a medical inspection is probably the wrong term for it, but being seen by somebody, and then having an address they could report to. And admittedly, I don't know the number, and I want to get you the right number. Let's see. I just received a release from Cumberland Valley District Health Department. It said they've identified 12 new COVID cases among residents of Jackson Manor Nursing Home. The release said several of the individuals were among residents who tested negative earlier. Is this a concern? Potential false negatives? I think this is exactly what Dr. Stack talked about. There can be an error rate depending on how the test is administered. But remember, there are also, if you test folks too early, folks can test negative that then develop the virus itself. One of the reasons that we've always tried to test with limited resources, very specific tiers or priority groups, are exactly because of this. But yes, this is one of the things with this virus. People can have a test. The test is too early, even if they've been exposed, but test negative before the virus exerts itself. This is just part of dealing with COVID-19. My memory is the governor wants to have all residents of long-term care facilities tested. Has the state required that? We want everybody to get to the point where they can get tested if they need it or even if they want it. And certainly one of our highest priorities is individuals in our nursing homes. We admittedly don't have the capacity today to go out and test everyone in every nursing home, but it is one of our top priorities. We're seeing more tests as a percentage, I believe, every day done in those facilities. And we're seeing significant resources in making sure that we can triage the situation that is in any nursing home. Remember, moving folks from a long-term senior care facility can also be very hard on them. And so it's a very complex analysis of if people are stable and there is a, say, COVID wing that they can be taken care of, that may be the very best thing for them. And so it's every single one is different, but certainly the long-term care facilities and our senior facilities are getting our utmost attention. Eleanor?
It sounds like there might be an update on unemployment compensation next week, but is there anything you can say for those people that have filed and haven't received anything yet, just to put their hearts and minds at ease a little bit?
To those who have filed for unemployment and we haven't gotten to you yet, this is our responsibility, and I'm sorry that it's taking so long. And I know that that's not enough, but you will not be penalized for the amount of time it's taken. You will get your benefits for that full period. We are staffing up faster than I know of any area that we have ever done. We are paying more claims and getting more people into the system on any given day than ever before. So we're doing our best, but our best isn't good enough if we haven't gotten to you. So we will continue and continue to work on it. Please hang with us. Have there been people, say, ages 60 to 75 who've tested positive, but it's still exhibited mild or no symptoms? The answer to that is yes. Again, we're still 4 months in, really, learning so much about this virus. But there are people that are in that age group that we worry about that, yes, have very mild symptoms or none at all, including some in the senior living facilities. So what's happened on some of these is you'll get one person who is sick or showing symptoms, and if you have the resources, you'll come in and you'll test a whole floor of residents or maybe even more. And you know what? You get positives in some people that you would never expect it. They're doing great. And we're happy about that. But yes, it can manifest in those areas with or in that group of individuals with very little symptoms. Monica?
I know the president has released a bill or a relief package to help with farmers, and that's going to be dispersed across the country. But do you have anything you can say to Kentucky farmers who are working really hard to keep us fed?
To Kentucky farmers, thank you. You are a part of what we're now calling our food supply chain. We're using new terms like PPE and swabs for our testing kits. We never thought we would, but our farmers have always been so critical. We've talked about them in the past with trying to end, say, childhood hunger and trying to improve our overall health. But right now, our farmers are out there every day making sure that we can get through this pandemic and that there is enough for everyone. I'm excited the federal government is stepping up and is providing specific relief to our farmers. I'm also excited that our governor's office of agriculture policy is continuing to invest in innovative methods that our farmers are engaging in all over Kentucky. When we move out of this, and we will, I'm still so excited about what we can do in the area of agriculture technology here in Kentucky. And it's not just some of the things that I've been thinking about companies we can bring in, but there are so many amazing things that individual farmers are doing right now just to support what they're doing, that they could scale up and that be the next great innovation across this country. One of the reasons we are in a better place in Kentucky than other places is our farmers and other hardworking individuals out there. We'll go through just a couple more really fast. Joe?
So your inaugural committee fund had its report filed at the end of last month, and it had $43,000 left in the account. Have you considered donating the rest of your inaugural funds to your Team Kentucky fund?
The question is, my inaugural fund had about $43,000 left in it. Have I thought about giving that to Team Kentucky? I don't believe I can under the law, because Team Kentucky, how it's classified under the IRS, doesn't allow that. It's not just a regular 501c3. We are going to look at ways to use that money to help people and to make positive change. I've just been focused on this coronavirus a little bit more. Eleanor? Nope. Monica? One more? All right, Joe, one more. It's your birthday.
I don't quite understand, a lot of people don't understand, why is Kentucky the only state in the country where chiropractors can't remain open? Can you explain why Kentucky is the only state right now?
The question is about chiropractors, and I've heard that we're the only state in the country where we have had orders that apply to it. I don't know that for a fact. I was relying on our public health experts and the situation we are in, both with PPE, but also the honeybee issue, where one individual seeing multiple other individuals, just like when we were asked about certain other professions and how it could spread. Dr. Stack, you want to chime in on this one?
Well, so chiropractic is a real hands-on experience, and so there's a real concern about how it's very hard. You have to be very personal with someone in order to do that, and the amount of PPE required. But there's another facet. When we started doing these restrictions, hands down, that community got the most complaints coming in time and time again early on, that there were violations of the rules. And so at the time we were creating all of these restrictions, we were trying to very rapidly protect the public from getting exposed to this virus that we didn't know as much about. Now, as we go forward, so an open message to every community, not just chiropractic, but every community. But since chiropractic was the source of the question, please propose to us how you will be able to efficiently use PPE and what you will be able to do in order to socially distance and help to keep people from getting infected. We want to reopen as much as we can and get people access to care. This is not intended to be harmful to any one population. It was an attempt to protect Kentuckians from getting exposed to a virus that we have no treatments for, no vaccines for, and we've just seen the consequences can be just too severe for people who get infected.
All right. I made a commitment to those that carry this, and thank you to everybody out there helping us reach Kentuckians and updating them every day. I haven't thanked partners in the media in a while, but we wouldn't be where we are. We wouldn't have flattened this curve, even with our results today, if you weren't out there keeping people informed, reminding them of the 10 steps, however you do it. So thank you to those that are also reaching out every day, like I am, to talk to people, to make sure we're staying calm and to make sure we're staying healthy at home. Each and every one of you in the media that's out there communicating with people have also been a very important part of Team Kentucky. Folks, we had our highest number of cases today. That doesn't mean we are not on the right track. We are. This is just how this virus works. So let's remember, as we are making plans and we're getting the plans in to reopen our economy, that we are still in the midst of the pandemic. And let's make sure that we do what it takes to protect the people around us, because we want to get through this, and we want to get through this together, and we want to protect everybody we can along the way. So we're going to lead you with just a video to end tonight with some other individuals out there spreading the message of Team Kentucky every day. Thank you, Rachel. Thank you, James. Thank you, Kenneth at home. Thank you, Dr. Stack.
Hey there, this is Dina Watt with the Scott CTC admissions team. We hope you're doing well, and we wanted to send a little shout out to you today.
Hey, it's Miranda.
Hey, this is Victoria.
This is Tiffany.
Hi, this is Addie.
We will get through this together.
Estamos todos en esto juntos.
We hope you're staying healthy at home. We are Sky CTC proud, KCTCS proud, and together, Team Kentucky.